Undunankulu waseGauteng uthi ngokwemniningwane ehlinzekwe yithimba elibhekele izindaba ze-COVID-19 kulesifundazwe, lesifundazwe sisesontweni lesithathu, lesiwombe sesithathu sokubheduka kwalesisifo.
You would remember that on this, the week that is on the 14th, it was the 14th of May, we already said the numbers we are seeing are of great concern to us, that our province is crossing the threshold of what would define high-risk infections. So over the past 3 weeks, that evidence presented by Professor Milado shows that over the past 3 weeks, we have had sustained increases.
Lokungeniswa kwabantu ezibhedlela nakho kuyaqhubeka nokwenyuka.
So increase in the number of daily cases and the weekly average is one concern. The second concern is the increase in the number of hospital admissions. As you would have seen by now, as we speak now, 2,866 patients have been admitted in Gauteng hospitals, both public and private.
Umakhura uthi kuyakhathaza nokuthi lesifundazwe sihamba phambili ngesibalo sabantu abashonayo nsuku zonke ngenxa ye-COVID-19.
Gauteng, in the number of people, the daily mortalities, Gauteng has been leading there. It's a matter of great concern to us when there are more people who are passing on a daily basis. In fact, in terms of daily, as we speak now, Gauteng accounts for at least half of the daily cases that are reported nationally.
Lesifundazwe sithi ikhona imali esibekwe eceleni ukusiza ngemizamo yokubhekana nesiwombe sesithathu se-COVID-19 kanye nokugoma izakhamuzi.
Over and above the bed capacity, we have been able to have funding allocated to support the staff. We have 1.85 billion allocated for the staffing, and in that 1.58 billion, we have been able to fill 5,521 posts at the 1st of July, and all those posts are posts that are now available for us to face and confront the third wave as part of and the breakdown is, of course, the 1.5 billion towards the temporary appointments, and there's money allocated for nursing agencies, 15 million, there's 43 million for data improvement and data management, and of course there's also 44 million that is being directed specifically to hire and employ people for vaccinating projects.
Undunankulu uthi ukwanda kweindawo lapho kubhebhetha khona lesisifo kulesifundazwe kulamasonto amathathu edlule kukhombisa ukuthi lesifundazwe singaphindela ezibalweni zesiwombe sokuqala nesesibili lapho kwakutheleleka khona abantu abangaphezulu kwe-1,000 eziyisithupha ngosuku olulodwa.